If you're a woman and you have been living in the UAE for many years, then there is a great chance that you have come across Dr. Humera Raees, specialist gynecologist at Zulekha Hospital Sharjah. We'll just have a word with her she will share her experience and the knowledge that she has with us. Assalamu alaikum, Dr. Humera, how are you?
Walaikum assalam, I'm fine, thank you, Asma.
So before we just go ahead and start off with all the technical kind of questions or more knowledgeable kind of questions, can you just tell us a little bit about yourself and your department in Zulekha Hospital and what kind of services that you offer?
Well, I'm Dr. Humera Raees. I'm a laparoscopic gynec surgeon and working as a head of Department of Obs and Gynae in Zulekha Hospital Sharjah for the past 15 years. And I have a very equipped, multilinguistic and very skilled team of gynecologists in my department, which are present on the floor 24/7 to serve the patients who are coming to our hospitals for their help and guidance. And in our department, we are taking all type of high-risk obstetrics and gynae cases. We are working basically as a tertiary care hospitals, where in regarding obstetrics, we are dealing with the high-risk cases like placenta previa, antepartum hemorrhage, previous car pregnancies, even more than 5 cesareans. We are doing the patients who are having more than 5 cesareans. We are doing cesareans here. Apart from this, we have a very good team and very well-equipped unit of neonatal intensive care unit, where we entertain all the deliveries after 24 weeks of pregnancy, and babies usually come out with a very good outcomes. Regarding gynae, we are dealing with all gynecological problems like fibroid uterus, adenomyosis, bleeding problems, and endometriosis and infertility, and all kind of surgeries we are doing laparoscopically here. And patients are very well satisfied from us.
So, how many children have been born during the time you have been with Zulekha?
Actually, I never counted it on, but I can say like 500 to 600 babies per year, you can say.
Oh, okay, mashallah, that's quite a huge number. So, doctor, speaking of the pandemic, there have been many expats who have not been able to go back to their home countries because of the travel issues and all that. So at Zulekha Hospital, what are the kind of options or the treatments or provisions that you give for the UAE residents? What extra do you give?
Actually, unfortunately, because of the pandemic, there are many reasons for the patients not to go back, because of the high cases of incidence in their area where they are living or due to the travel restrictions. So by taking account all these things and current scenarios which are going on, we have reduced the delivery packages for normal delivery and cesarean sections, and I think now it is quite comparable and affordable for the patients. Apart from this, we have Super 25 offers in which the patient gets 25% discounts on consultations and 25% discounts on all the investigations which we prescribe in our outdoor as a outdoor patients. And apart from this, we have many campaigns like cervical cancer campaign, breast cancer campaign, second opinion campaign, in which patients get the free consultations, and some tests like pap smears and mammography they are getting free.
Right. So for all the women who have not been able to travel, and I know the reason is we always want to travel is because of the familiar home surroundings that we get when we go back to our home countries, and the familiar faces we have. We have our mothers, our sisters to support us. But at Zulekha Hospital, they have home care services. Even in hospital, they provide you services where you don't miss these comforts of home. Is that right, doctor?
Yeah. We have special home care services where our specialized nurses go to the home and they guide the patients as per their need.
I want to particularly ask about the COVID vaccine. Is it safe for pregnant women to take the vaccine, and at what stage, if it is safe for them, at what stage should they take the vaccine?
Actually, coronavirus is a relatively new virus, and many researches have been conducted on this, and many trials have been carried out, and still many trials are going on. The data from the all trials, what they have shown so far, that some vaccines are safe in the pregnancies in many European countries like Pfizer, Moderna, patient can take it, and these are quite safe vaccines. And in DHA also, they are giving the Pfizer vaccines to the pregnant ladies. And as we avoid all the medication in the first 3 months of the pregnancy, I think we should avoid this also. But still, I will suggest anybody who wants to take the vaccine, they should call their concerned centers where they are giving the vaccine. They will further guide them that what type of vaccine they can take it. But usually, it's safe to take some type of vaccines in the pregnancy.
Right. So because when the pandemic started, pregnant women were not part of the first group of people who were allowed to take the vaccine. Who were not. So now it is okay for them to take it. Okay. Right. What are the diseases that are treated through this surgery, and what are the benefits of this surgery?
With the laparoscopic surgery, we can deal almost all kinds of gynecological problems. Like as I have mentioned it already, like fibroid uterus, patients with adenomyosis, patient with abnormal vaginal bleeding problems. Apart from this, endometriosis, ovarian cysts, ectopic pregnancies, infertility. So we can manage all type of these gynecological problems with our laparoscopic surgeries. The advantage of laparoscopic surgeries are definitely more than the conventional open surgery. First thing, it is a cosmetic surgery. It's not like a big scar, so cosmetically it is very good. Second thing, patient is a less pain as compared to the conventional open surgery. Then apart from this, patient has a shorter stay in the hospital. Patients are discharged early from the hospital and they can go back and carry on their normal activities as early as possible.
Right. So if we want to explain what actually is laparoscopic surgery, because I know it's a term, but maybe many people who are watching, they might not understand what it means. So in very easy language, if you can just explain what actually happens during that surgery.
I will say it's a keyhole surgery in the slang terms. We make up holes in the body, and through holes we complete all our surgery.
So that is why it is quick. Okay, so that is why there is quick healing as well, because it's a small. All right, thank you for that. In this position, when there is the pandemic and people are not able to travel again, so what are your tips for new mothers, expectant mothers, and how do you make them comfortable actually during this time?
Actually, we are always available to advise and guide them, so that the new expecting mothers, they can be well versed about being the new mothers. For that, we have special antenatal classes in our hospitals. We conduct it regularly, and in that we invite and give offer to all pregnant mothers, where they come up with their different basic daily basis problems, where we guide them what to do. We guide them about the exercises in the pregnancy, what they can carry on, and if they have any concern and queries, we try to settle out there. Apart from this, we guide them how to do the breastfeeding, what are the advantages, disadvantages of breastfeeding. Apart from this, as already I have mentioned, that we have a home care services available, where our trained staff go to the house from the hospital, go to the home of the patients and guide them as needful.
Okay. So doctor, is there any telemedicine opportunity you give, or do they have to come for these classes?
Actually, the thing is this, because of this virus and especially the people think that the rate in the hospital is very high, which is true, because to us all the patients come who are definitely sick. So patients are scared to come to the hospital. Yes. So we have the provision of teleconsultations, in which we can guide the patients and can share their concerns on telephone.
Okay, so that is available for them. So that is a very, I think, big facility that is available for many women who might be scared to come to hospitals for consultations. Doctors are available very easily. So doctor, again, after delivery and actually during even pregnancy, very many women, they skip, their lifestyle is changed, they're not very active, they become lethargic. So what, also emotionally they are weak, physically they think they are weak actually, but then what do you advise them? How do they get back to on track, even while they're pregnant and after delivery as well?
First thing, Asma, I will say the females are stronger. That's why they carry all this stress of pregnancy, baby and all the things. So females are never weak, they are stronger, which I believe. Actually, after delivery, we refer the patient to the dietitian, which encourage them to change their lifestyle by giving the guidance regarding diet and exercise depending upon what is the age of the patient and what type of surgery they have undergone. Apart from this, we call the patients, we call our all post-operative patients after discharge to check with them, are they doing okay? If they have any concerns, we share with them. And we have made special WhatsApp group with the name of Motherhood, in which we had the WhatsApp number of all the expectant mothers, all the pregnant ladies who comes to our hospital, and it's a live group which is responded by our hospital team. Whatever the questions, queries they have, they can share it and it is answered.
Actually, that's a very good idea, and actually you're very right. But I just wanted to tell the women they should not think they're weak. Like the doctor said, you're very strong, all of us. We give birth. I think there's nothing braver and stronger than that is. So doctor, you mentioned something about the dietitian and all that. Is this all included in the package?
This is free of charge. It's a free of cost.
Okay, that's a great kind of addition that is there to the services. Doctor, there's just a couple of questions from the viewers that we have. Rabab Hussain, she's a housewife and from Dubai, and she asks, is it possible for a newborn to get COVID from the mother during birth?
Yes, studies and trials are going on, and as I said before also, this is a new virus and many things are known, many things are unknown about it, and everything will be more clear as the time will go on. But some places, some trials have shown that if the mother is COVID positive, there is risk of transmission from mother to the baby through placenta.
All right, so there's another related question to COVID again. Myra Nakwi, she's another housewife. So she also asks, can I breastfeed my baby if I have COVID?
Yes, you can breastfeed your baby while you have COVID. This is to be COVID positive is not a contraindication for the breastfeeding, even if your baby is negative. But you need to take certain precautions, like you have to wear the mask, you have to wear the gloves, you have to wash the bottles, and all these precautions. By taking all these precautions, the patient can breastfeed. This is not a contraindication.
Right. Thank you so much, doctor, for your time. And I'm very sure in this short conversation we have had, it's been a lot of information and knowledge for all the people who would be willing to come to Zulekha Hospital. And we really appreciate the time you have given and shared this knowledge with us. For all of you, now, these are basic questions. There's a whole package that is available here from Zulekha Hospital. There's a WhatsApp group where you can connect as an expectant mother, or if you're planning to be pregnant. And Dr. Humera here has lots of experience. She already gave you numbers of the number of babies that have been born during her time, 15 years at Zulekha Hospital. So with this Doc Talk episode, until next time, see you again. Allah Hafiz.